Welcome to Health Matters with PA Lynn Szabo.
Hi.
Hi, how was your week?
It was good, except not so good for Planned Parenthood. The Supreme Court is allowing states to move forward with plans to defund Planned Parenthood, specifically targeting them in certain states.
So I take it that's the topic this week?
That would be, because I feel like that women need to know about contraception. That is the majority of what Planned Parenthood does, is provide contraceptive health care for women. And so I thought I'd talk about it. So it's unfortunate that they did that, and hopefully it can be overturned in saner times. But this denies women vital health care and takes away one of the most basic rights that anybody should have, which would be bodily autonomy.
Absolutely.
Yeah. So healthcare is hard enough to come by in a rural community, and reproductive healthcare appears almost non-existent. It's kind of interesting between the two counties, Humboldt County and Del Norte County. Even the way a provider can talk to a patient. For example, when I was working in Humboldt County, if I say, "Are you contracepting?" women get that. They know what it is. And if you say it up here to a woman, she doesn't know what you're talking about.
So what are you talking about?
You are talking about, are you using a form of birth control to prevent pregnancy? Or are you seeking pregnancy, which might be a whole different conversation and what that woman's health care needs would be? Or are you just winging it because you don't have any information?
Okay.
So,
is it information or is it access or a combination of both?
I think it's both, but I think it doesn't even occur to women that they have a choice up here. Oftentimes, especially younger women, especially women who are otherwise healthy, don't really go to the doctor very often. There's a lot of crossed fingers out there.
Is this primarily women who are on Medicaid or have no access to health insurance, or does this?
I think it's primarily younger women.
Younger women, so regardless of socioeconomics,
right?
It's okay.
Yeah, and younger women who are, healthy and they don't interface with the medical system very often.
Okay.
Like maybe they get a cold a year or something, and they just don't think about health stuff in the same way. They don't think about the consequences of that particular Friday night. Or if they're kind of vaguely aware of it, they just kind of roll the dice.
So is that just like typical youth mindset of I'm indestructible and everything will work out for me kind of a thing?
I think that's where it starts, but I think it's possible with education to kind of bring women around, and men too, actually, to a more thinking place of, oh, I better plan this out a little better.
I appreciate you mentioning men in there. They're responsible for...
They do. And it's as a little aside, one of my dearest wishes that I could hand out postcoital contraception to men and that they could use it responsibly and lovingly and just have it available, because I think the availability really limits that.
Do you think they'd take it if they had the same side effects women do?
Not for them, but to have it. And my hope is they wouldn't coerce anybody either. That's my other fear. But, that everybody could be mindful and respectful and could move forward with decisions that are recognizing that a woman takes on a lot when she takes on a pregnancy.
Absolutely.
Yeah.
Being respectful and mindful of one another is...
And have those discussions and make plans and not just kind of fall into bed without thinking about it. So the first topic here is hormonal contraception, and these are things like oral contraceptives, the contraceptive patch, which is a transdermal birth control. It means it crosses the skin. The ring, the vaginal ring, which used to be called NuvaRing, that gets placed in the vagina. Injectable hormone contraceptives like the ever popular and Del Norte Depo-Provera, and IUD, also very popular in Del Norte, and the implants that go by the brand name Nexplanon. Originally Implanon, and then the newest one is Nexplanon.
Okay.
The risk of pregnancy with these methods varies from less than 0.1% per year. So if 100 women are using a particular method, and in this case it would be the implants, so Nexplanon, less than 0.1% of those women will get pregnant over the course of the year. I have never seen it in my career, although I've heard tell about it. But I think those are actually women who were pregnant when they had the implant placed, and it was just too early.
That would make sense.
Yeah. The most.
So just to go back to that, so if you have that implanted and you're pregnant, does it affect the pregnancy?
No.
Okay.
No matter what the outcome of the pregnancy is.
Okay.
So it's the most, what I like to think about it is the most effective form of reversible birth control for women in the history of the world. So if you're the one that's thinking, okay, I've really thought about this and I cannot get pregnant, then this is the one for you, unless you have a medical contraindication.
Okay.
And then for the pill, about 8%, so out of 100 women using it for a year, about 8 of them are going to get pregnant.
Okay. So that's where people say I got pregnant
while I was on the pill.
Okay.
And they're pretty clear on how that happened. So people forgetting to take pills is the big one on that one.
Is it forgetting to take pills? No, I'm old enough to be like, you have to take it the same time every day. It has to be consistent.
Right.
Does that really matter? Is that part of the 8?
It isn't for combined oral contraceptives. So the ones that have estrogen and progesterone, that is for the mini pill. But it's important to get it roughly at the same time every day.
Okay.
Okay. And then those same failure rates exist also for the patch and the ring. And those, I think the patch fails a lot because of adhesive problems, like it falls off or somebody becomes allergic to the adhesive or, also a barrier to care. They can't get it at the pharmacies because a lot of the pharmacies here don't routinely carry it.
Why would they not carry it?
Because although it's against the law, there's some judginess for women going in to get birth control, especially if they're younger and not married.
Oh.
Yeah, and certain pharmacies realize that that's illegal and they don't allow it, and certain pharmacies are a little...
So they just don't stock
attention.
it, so it makes it difficult.
Right.
So it's an intentional barrier to care.
Right. And they hassle the women.
I'm going to get a little bit upset about this.
And for the pill, the patch, and the ring, these are all easily reversible. So if somebody... doesn't like the way it makes them feel or feels like it's really not the right method for it, it's pretty easy just to stop using it and, go get another form of birth control. So, but there's an emphasis right now in teen women, even though they kind of politically don't understand what's going on with their access to reproductive health, they have great fear that that access is going to be taken away. So they have a passive terror about it. And they're interested in IUDs, which is kind of interesting. IUDs are more difficult to put in younger women who haven't had pregnancies, although there's certainly younger women who can successfully get one placed and successfully use it. So it kind of depends. It's not really a global understanding, although providers are reluctant to put it in younger women. When Planned Parenthood let go of that, because it's not a data-driven way of looking at IUD use, that it was amazing how many young women were, and I put IUDs in women as young as 12.
Wow.
Postpartum, yeah.
Oh my gosh.
Yeah, and they've done great, no problem, scrolling on their phone.
Why are providers reluctant to put it in to younger women who haven't given birth?
Because it is an uncomfortable procedure that was kind of not really legitimized by the medical profession for a long time. Now that's starting to change.
Okay.
But there are ways you can support women through it. It's probably reasonable to provide opioid pain medicine on an extremely limited basis while somebody's getting an insert.
Okay.
Yeah. Although that's a kind of a new way of looking at it. That's where women's voices made a difference. And women talking about their IUD insert experiences as being incredibly painful, and why didn't anybody pay attention to their pain? And I think providers are starting to pay attention to it now.
That's good.
Yeah, I know. I'm starting to prescribe Vicodin for it.
Okay, just for the day of the procedure? Or?
Yeah, maybe the day after.
Okay.
So, and then also ibuprofen and Tylenol are also good for pain control during those procedures. So, there's ways to mitigate it. You can also have a support person in the room. Planned Parenthood does acupressure. There's all kinds of things, ice packs, stuff like that, heating pack.
Okay.
Anyway, it gets complicated. But the thing that women who are using IUDs may not be aware of is that the Mirena, which we were initially told was good for 5 years, is now good for 8.
Oh, wow.
And the Paragard we were initially told was good for 10 is now FDA approved for 12. And some people say 20. Studies are ongoing. So these IUD methods are great, especially at Paragard because it involves no hormones, but that these methods are going to be extremely effective for a long period of time.
Okay. And then once they're removed, if you choose to have a child, how long till conception occurs?
Oh, this is my favorite reproductive health joke, that you have to wait till you get home. Fertility is restored like immediately. So, yeah.
So not in the office and not in the parking lot. Got it, Lynn.
That's right. And then I think some women, as far as birth control pills, are not aware that there is an over-the-counter option called O-pill. And it's a progesterone-only pill, and it's available over the counter. So it's probably expensive. It is a version of what used to be called the mini pill, which is what you were kind of referencing, that you have to take it. It requires a certain amount of attention to detail, and it has to be taken at the right time every day, consistently. So all of these methods are really easy to get at teen clinic, and all of them are really effective, and the education that goes along with them, I think, can be really helpful. Managing side effects. People should also be aware that birth control pills, there's like 100 kinds of birth control pills, and they're all different proportions of the two hormones, estrogen and progesterone. And if a woman has a problem with an initial pill that she's given, there's a solution for that in the birth control pill realm.
Okay.
So she shouldn't feel like that's it. That pill's not an option.
So if you're taking one form of a oral contraceptive and you need to switch to another one for whatever reason, does that, in between while you're switching, does that make the efficacy drop? Or is there a greater risk for pregnancy?
It depends how you do it, but it's probably the most effective way would be to be able to switch during a menstrual cycle.
Okay.
Yeah, that would be the best. Your body does not need a break from hormonal birth control. I can't tell you how many. To me, what that sounds like is, in the back of my mind, I'm thinking it would be okay to be pregnant. There's studies of women using hormonal contraception from their first period to their last period. And
where did that "you need a break" come from?
I think it's that's actually a really interesting question. I think it's partially kind of distrust of the method. Like the whole idea of somebody, quote unquote, messing with your hormones seems like it shouldn't be right. And I think it's also an idea that's planted oftentimes in young women's heads from somebody who may not have their best interests at heart.
Okay.
It's not a thing, ladies. It really isn't. We have great data all the way back from the early 60s when the pill first came out that women can take it the entire time that they're fertile.
Wow. So there's just all that misinformation still exists.
Yeah. And your body doesn't need a break. That's just code word for I'm thinking of getting pregnant. So, of course, there's emergency contraceptives, including Plan B. And now since Plan B is generic, it's gone into generic production, they call it Julie, which is a ridiculous name. I think it's so teens can be subtle and say, "Hey, I'm going to pick up Julie. Okay, bye, Mom." And anyway.
Oh my gosh, way to get around Dad.
Luckily, there's a lot of free Julie around. But and then Ella, which we've talked about before, and women should know that Ella is the upgrade from Plan B.
Okay.
And it's helpful in a lot of different ways, but one is for women whose body mass index is over about 30, which is kind of everybody. And for women that had their whoopsie greater than 3 days prior to their decision to take an emergency contraceptive.
Okay.
Or if it's a lot of sex around a fertile time. So it was I guess a potentially, higher fertility possibility whoopsie.
Okay.
So,
And now this is, I'm just going to go there for a second here. We live in Northern California, Southern Oregon area, super conservative, super religious. And I hear people all the time say that the emergency contraception is the abortion pill. This is not an abortion. This is emergency contraception that stops conception.
Yeah. Yeah, that's pretty clear how it acts. It's not an abortion method.
So for anybody out there who spiritually doesn't believe that they should, this is not an abortion pill. This is an emergency contraception the same way as taking birth control.
Right.
Okay.
Yeah.
So I just want to make that distinction and make that clear for people.
I think spiritually, if I believe that abortion wasn't something I ever wanted to pursue in my own personal life, that would be my own personal choice. I would still be comfortable taking this.
Okay.
Yeah.
Same.
Yeah. And so then the non-hormonal methods, I touched on the copper IUD, but let me also say the message. It will make your period longer, heavier, and crampier. This will happen. This is a certainty.
That does not sound
fun.
No, at all. Why would anybody want to use that? Well, hey, take this. You won't get pregnant.
Super popular in Southern Humboldt, where there's kind of a distrust of hormones.
Oh,
so, for women down there, their personal belief is that this is a reasonable trade-off.
That would make sense.
Yeah. So, but a lot of women get it placed, and they're all kind of have a superficial, like, oh yeah, that must be good, but they don't realize what the trade-off is, and they come back to see me in 6 months and say, nobody told me this. I'm telling you this now.
Thank you.
This is definitive.
And that's with the copper.
Yeah.
Okay.
But it's very effective. Easy to reverse, takes like 10 minutes.
Oh, wow.
Like I said, now lasts 12 years, and some people think longer. Condoms. We have glow-in-the-dark condoms at Tea and Clinic, and you want some.
And flavored ones.
Yeah, we have flavored ones. We have dental dams. We have all kinds of stuff. And we have not to endorse a brand in particular, but we have non-latex ones. We have latex ones, and the latex ones their marketing people are genius, especially for the younger consumer, because, they're all like slightly edgy design and, graffiti oriented. And here's the inner city ones, and here's the rainbows ones. And
nice.
We got a lot. They're interesting, so if nothing else.
Just because you're talking about teen clinic, and my mind goes there with the teenagers who are going to be taking these things and keeping them storage on condoms so that they're still effective. Can you put them in your wallet and put it in your back pocket and keep it there for a year?
No. You have to trade it out. There's if you're going for a latex one that has spermicide on it, there's a expiration date, so you have to pay attention to that. But you can't really keep it in extremes. Okay. So not in your car glove compartment, for example, not on your wallet that rides in your back pocket that you're sitting on and walking. There are actual plastic condom cases that you can use. But temperature is the thing to think about.
Okay. Thank you for that.
Yeah. And then there's a new method that I don't think a lot of women know about, which is called Phexxi, is the brand name. It is over the counter, and it is not a contraceptive. It is a gel that's inserted in the vagina before intercourse, and it is not spermicidal. So it doesn't blow the little guys up. It just makes them do freeze tag so they don't get further in than the vagina. It is... there was a lot of hope about this. It's hugely expensive, but it's covered by the local family planning grant money. So with a prescription, you can get it on the grant money. But if you were just buying it over the counter, it's like $350 for a tube with 6 applicators. But and I doubt that it's carried in any of the over the counter pharmacies here. But talk to your provider about getting a prescription, and it's likely covered by Medi-Cal too.
Okay.
I would think. But realize that it is not as effective as they're advertising. Planned Parenthood was all over this one.
Okay.
But then it became apparent that out of 100 women using it for a year, about 20 get pregnant. So it's probably best used with condoms.
Okay.
And
it has to use before intercourse, not
right,
after.
Yeah.
Okay.
And pre-cum is a real thing. So it really has to be used before the penis is in the vagina.
Okay.
But it's Phexxi is PHEXXI if you're, it looks edgy and cool. But for a lot of women actually can't take hormonal methods and maybe aren't interested in an IUD, this is a really good option to use with condoms.
Okay.
And then with morning after pill like Ella or something as a backup.
Okay.
So this could do the trick for you. So permanent sterilization, like bilateral tubal ligation or vasectomy. Vasectomy is not the big deal that men think it is. There's a lot of fear about it that's unfounded. And I've seen a lot of them, actually seen them, and at one point was going to be trained to do them. But it is nowhere near what women go through with contraception, say an IUD being inserted, or with a pregnancy, or if they choose to end their pregnancy with a surgical or medical abortion. Okay. Really, a vasectomy is not a big deal.
So men need to be men and step up and do that.
Right, and luckily we have a local physician who's really good at it.
Okay.
And so this is a resource we have. So his name's Tim Nicely. He works in the ER. He also does a lot of deliveries, and he offers vasectomy through his private practice. Start by Googling With Open Arms if you're interested in accessing care. He's up here often, so it's something that could probably be done up here, but it also could be done in Humboldt.
Okay.
So you might be wondering, where am I going to get access to all this stuff? Well, Teen Clinic happens in Crescent City on Tuesday from 1 to 5 p.m., right across from the hospital. The sign is like bigger than, it's the side of the building, so it's easy to see. It's open. I open it. I'm the clinician who does it most of the time, and I open it to anyone in need. I don't card people. There's a lot of women who are maybe in their 40s or something, and if they have reproductive health concern or maybe need to be treated for an STI, that's a good under-the-wire way to do it.
Just call the teen clinic and you're...
Just show up.
Just show up and you'll take care of them.
It's easier than that. Yeah, if I can take care of them there, I will. And if I can't, then I'll facilitate care elsewhere. Okay. So, and also, since I do the acute care clinic at Del Norte Community Health Center on Saturday, that's another good place to get this type of care. It's a little harder to put an IUD in there, although they have other clinicians there that can do IUDs.
Okay.
It's just because it's Saturday. And always, Planned Parenthood is both in Grants Pass and Eureka, and that's actually where I worked for a long time, so that's where a lot of this information is coming from. They're excellent places to get care for women and men, for all aspects of reproductive health, and then also sometimes they do family practice. It depends on the clinic and the situation. And then there is grant money. We should talk about money always in medicine. So in California, but not in Oregon, this grant program is called Family Pact. It used to be called, I think, SOFP or something. But it covers for income-eligible people, which is a pretty low bar. It covers all aspects of reproductive health in a confidential way. So if you're a teenager, there's no bill that goes to your house so that your mom can see. That's a pretty common question. And it's not like they check people. We go on what people write on the form. Okay. If they don't want to give me their phone number, they want to give me their girlfriend's phone number, just as a protection against their confidentiality, we'll go for it. If somebody tells me that they aren't employed and so their family income or their personal income is zero, I don't question that.
Okay.
Yeah. So it's designed to be really private, which is super important in a community like this.
It really is.
Yeah. And it's super helpful. We can oftentimes hand people the product that they need right there.
So for our we do have a substantially high homeless youth population here. It's my understanding in our region, we have a high population of homeless youth. So they can go to the clinic and
They totally can.
and they don't have to worry about funding or paying, or nobody's going to tell you anything.
As long as
they don't
it's
have to give you their
reproductive
partnership.
health care. But it could also be a door into, primary care if that's what they need.
Okay.
It's also meant to be an entry point for people. And I actually think teen clinic is all about adulting, because you have to learn how to fill out the form, and you have to learn that you can't just walk directly into my exam room and start talking when there's 3 people in front of you, stuff like that. And I have food there if you're hungry, if you need it. And oftentimes there's actually food boxes available, and we have all kinds of stuff. And we talk openly, and there's education there, and nobody has to giggle because they said the word penis, okay? So it's a good place to start if you're nervous about trying to navigate the medical system, if you're a young person and it seems overwhelming.
Good to know.
Yeah. So I think it's important for women up here to be more educated. I think the young people in this community need dreams. And one of the ways that you make your dreams grow is you organize your life in a way to make those dreams possible. And this might be, for some people, the way to do that is to put off maybe having children to a little bit down the road after education, or after establishing in a job, or after they travel, or after they get to see the world and make decisions for themselves instead of somebody making decisions for them. And that's why we're talking about this today.
Absolutely. It makes a lot of sense.
Yeah.
There's a lot of hopelessness here, and that unplanned pregnancy is just going to add to that.
Yeah. And it's kind of interesting that the young men seem really disconnected on the whole to this, but the young women are just kind of lost as what to do. That's a whole
that because they get to walk away and we have to raise the child?
Presumably, yeah. But that's another whole show.
That's a whole nother show.
Yeah. And next time, I want to talk about how RFK Jr. is destroying preventative medical care in the United States.
Oh, that's going to be a long topic.
Yeah.
That might be a twofer.
Yeah. So if you have an opportunity to get your flu shot, I always say wait till about Halloween, but now it's looking like there'll be shortages. And maybe you should get it in August when you can get it.
So
I don't know. We'll
as soon
talk
as they're
about
delivered,
yeah,
pick them up in August.
Yeah. So we'll see, there's a difference between what we fear is going to happen and the reality. So hopefully this can be stopped.
Will we know more about that when the budget goes through this week?
I imagine so.
Okay.
Right. And we can talk about that next week.
Okay.
Okay.
Well, thank you very much. We have our very own Wonder Woman here, PA Lynn Szabo. I appreciate you being here, and thank you very much.
Thank you.